Selam. I'm a psychiatrist from Ethiopia and year 6 Atlantic Fellow for Equity in Brain Health, and soon to be an alumni or Senior Atlantic Fellow. The reason I wanted to be part of the PPV is I'm planning to work on a pilot project on intervention to make treatment outcomes for people living with dementia and their caregiver better. So I'm thinking of different interventions for this group of population. So having an input or a feedback from people who actually go through the illness, like for the patients themselves and the caregivers who are actually affected directly or indirectly by the illness, having those inputs would be very important than just thinking this would be important to them, this would be helpful to them, and then trying to intervene on those areas. Having their direct inputs on my project would be more important. So I said this could be really important to take their inputs into it. So this idea is new for me. When I first took part in the sessions involving PPV, PPI. So the concept was a new idea for me. So, and I found it really useful to make it part of your project or your the works that you do. So as the idea is new for me, it would definitely be new for my colleagues back home as well. So introducing this idea to other colleagues and then trying to make it part of my current pilot project and also other projects in the future would be really useful. So including the patients, their caregivers, or whoever is involved directly in what you are intervening about would be really important, starting from the design into the implementation and also looking at the results, involving them in every step of the way would be really impactful, I would think. So I'm thinking of involving this kind of practice into my work when I get back to Ethiopia as well.